Everyone, it's Dr. Hodges. Today I want to do a little video on myths of bariatric surgery. I thought about doing this because here recently when I've been in clinic and I'm seeing new patients, they'll ask me questions. I'm like, no, that's not right. No, that's not right. I've done a lot of videos in the past where I'm always talking about how education is key. That is how we dispel myths. That's what I kind of want to do today. I'm going to take some of the top ones that I will get, and we will go from there and make it happen. Let's say myth number one, surgery is the easy way out. This one is so frustrating for me. Usually I will get this comment, usually from either a new patient on their initial consult. They'll say that that was the reason why they had a bit of a delay because they always thought it was the easy way. They wanted to do it the natural way. Or it's like one of their friends or a family member that's kind of on the fence. Frankly, I always think there's like a power differential, and that's part of the reason why it's like, you want your loved one to get better? For whatever reason, I do get this a lot where surgery is the easy way out. Let me just say this. There is nothing easy about losing weight. Whether you do diet, exercise, or surgery, nothing is easy. If you want to have long-term success, it's a commitment. And when it comes to these commitments, it's everything that you do every day. I was just watching a video. It had Tom Brady and Arnold Schwarzenegger. Both of them were talking about how they became so successful in their sports careers. They basically said they woke up every day doing the things that nobody else wanted to do. It wasn't that there was anything super special about them. It was just that they did it even when they didn't want to. Newsflash, when you undergo surgery, you're going to have some really good days and you're going to have some really bad days. It is not uncommon for me to have patients that will tell me a week or two after surgery, I think I may have made a mistake. I don't know if I can do this. Guess what? Yes, you can. Number two, surgery hurts. Nobody really wants to have a surgery. Recovery sucks too. That's the reality. No surgeon is going to tell you that. Nobody wants to go get a bobo fixed. No one. It's not comfortable. It's not appealing. But, when you get over on the other side, it makes all the difference. Is surgery the easy way out? No, it is not. Surgery is going to force you to make significant changes in your diet. Surgery is going to force you to make changes in the types of food and in the quantity of food that you're eating. You know what surgery is also going to do permanently that diet and exercise can't do? It is going to permanently affect the metabolic pathways in your body and how you perceive hunger, how you perceive fullness, how your body utilizes glucose, what your insulin resistance or lack thereof is, how your body utilizes fatty acids. All these different digestive pathways are going to be positively improved and impacted, which unfortunately you do not get with diet and exercise, regardless of how much diet and exercise that you do. The other thing that I have found is that there are true changes in your brain with how your body perceives foods that are appetizing or not. So it's not uncommon for me to have patients that will tell me that after they have surgery, they're like, I never really craved this food before, or I was never a huge fan of salads. Now I love them. Does this mean that after surgery, you're going to get stuck eating quinoa and kale? No, absolutely not. What I can guarantee will happen is that you are going to have a significant change in the types and the quantities of foods that you're eating, along with impactful permanent changes to your digestive pathways. It is going to be the combination of the two that are going to give you that upfront weight loss and then that long-term weight loss. There's nothing easy about surgery because you know what also happens? I'll have patients that are doing medical weight loss and they're like, I didn't want to take my GLP-1. I'm about to go on vacation. I wanted to be able to eat. Whenever people used to go get bands, they would literally go and get fluid taken out of their band because they were going to be going on a cruise and wanted to be able to eat more. You don't have that option when you have surgery. It is 24/7, baby. You are going to be on that weight loss train. You're going to be on that weight maintenance train. That's good. In the end, that is where you're going to get to the goal. In the end, that's what's most important. So there is nothing easy about surgery. It is not the easy way out. I will tell you, it's absolutely the most successful way out. If you have more than 40, 50 pounds to lose, I can guarantee you're going to be a good candidate for surgery. By far, you will have much more weight loss. In fact, studies have just shown that you will lose 5 times the weight if you undergo surgery compared with medical weight loss, which is meds and diet and exercise alone. So that's myth number 1. Myth number 2. I don't know if I really want that bypass. Maybe I'll go with a sleeve or maybe something like less invasive because I want the thing that's the safest. Okay, all of the surgeries are safe. It is safer for me to do sleeve, bypass, duodenal switch than for me to take out your gallbladder, which is one of the hernia and gallbladder removal are like 2 most popular general surgeries that are performed in the United States today. Hundreds of thousands of both of these are performed every year. Guess what? Bariatric surgery, safer than both of those. What is your risk for bleeding? Less than 5%. What is your risk for infection? Less than 5%. What is your risk for leak? And leak is whenever your staple line comes apart, less than 1%. Mortality rate, 0.05%. These are low-risk surgeries. I will sometimes have patients or their family members that are like, well, my cousin's best friend's hairdresser, they had bariatric surgery and they died. Did that same hairdresser also go trick-or-treating and find a needle in their apple or some poison in their candy? I really think a lot of the stories that I get from these old bariatric surgeries that were horribly unsuccessful, a lot of times I strongly believe that they are an urban legend. Now, is there some truth to the fact that patients did not do as well back in the day? But what was back in the day? Back in the day was like in the 80s and early 90s. It's 2026 now. We used to do these procedures open. Patients absolutely had worse outcomes because they were at a much higher risk for infection and for sepsis. Also, we did not have access to the nutritional elements that we do today. I mean, you can go to 7-Eleven now and go get a protein bar. Not a crappy protein bar, like a really good quality one, because now protein is king. Thank goodness. You, as a bariatric patient, you get to reap the rewards and the benefit of that. Is bariatric surgery unsafe? Absolutely not. It is incredibly safe. Patients generally are in the hospital overnight. They get to go home the following day. In fact, a lot of places you can even get a sleeve. Some folks will even get a bypass same day. They're doing that in an outpatient setting. So surgery is safe. They would not let you have the majority of your stomach removed if it could not be safe. So surgery, it is safe. Let me see, what is another? You're just going to have to be on all these vitamins for the rest of your life. Newsflash, the majority of Americans, we do not eat like we should. So most of us, whether you've had weight loss surgery or not, probably need to be on a good multivitamin because we're not eating a good, well-balanced meal. If you are a bariatric patient, you absolutely are going to have to do a multivitamin every day, calcium, iron, B12, vitamin D. Gonna have to do those. However, if you're a vegan, vegetarian, you know what you also have to be doing every day? Specific vitamins, because you are not going to get what you need from that diet that you're eating. So for a variety of different subsets of patients, they are always going to need to supplement with extra vitamins. We have a solution to that. You need to get a good bariatric formulated vitamin. I'll have some link below. I really like Bariatric Advantage. They have a couple all-in-ones. There's Ultra Solo with iron. There is Advanced Multi-EA. Ultra Solo, you just do one once a day. The Advanced Multi-EA, you do 2 a day. The Advanced Multi-EA is perfectly safe for you to take during pregnancy because there's only 5,000 IUs of vitamin A in it, which is what the recommendation is for a bariatric patient. So good vitamins, they're cheap. I know with the Ultra Solo, I think it runs less than $25 for a 1-month supply. It's everything you need in one once a day. Multivitamin, iron, B12, vitamin D. The only thing that you will have to do in addition to that is calcium. With the advanced multi-EA, it's going to be the exact same. Multivitamin, iron, B12, vitamin D. It's just with the advanced multi-EA, you do 2 of those a day. So, are you going to need to do vitamins for your rest of your life? Right now, if you have not undergone weight loss surgery, do you probably need to be doing vitamins right now? Do you have an issue with anemia? Do you feel cold all the time? Probably should be taking a multivitamin. If you're not, it's not just patients that have had bariatric surgery that really have significant vitamin requirements. However, with that being said, we have very inexpensive options. You do not need to go and get like this huge vitamin pill holder. It's not like how it was when I first started doing this in the early aughts, in early 2000s. You don't need to be taking multiple pills a day. One other caveat to that is I know that there's liquid vitamins out there. There are non-bariatric formulated vitamins. The problem with a lot of those is that you're just not going to get everything you need as a bariatric patient. There's one, I think it's called Mary Ruth's. I'm sure that is a wonderful vitamin. If you're not a bariatric patient, that is not a good option. If you are a bariatric patient and you are having hair loss, that's one more myth. You're going to lose all of your hair. When you lose your hair, typically in the very beginning, if you're not getting in as many calories, your body is not going to grow extra hair. Usually after about month 2, month 3, you're going to start to get little extra spriggies that are coming out. That's just because your caloric intake is going up. What can also affect your hair? Protein and iron. If you're not meeting your protein goals, you will not have hair growth. If you're not meeting your iron goals, or if you're anemic, you will not have hair growth. A lot of patients will ask me about Nutrafol. I need to do an extra video on that. That is a wonderful vitamin. I will tell you, if you are a bariatric patient, you are getting everything that is in Nutrafol and then some. So you're not really, there's no need to pay $80 for the Nutrafol if you're a bariatric patient. You know what you need to do? Take your bariatric vitamins and drink your protein. Then you're going to have your hair growth. Those would be the 4 little myths that I have hopefully debunked. Yeah, share them with your friend. Bariatric surgery, it's a good thing. You can do this. You just have to be consistent. That is with protein. It's with your vitamins. Once you get the weight off, then it'll be easier for you to begin to add in a little bit of exercise. You do not have to go and run a marathon. You also do not have to go and do a kickboxing class. Once you get to the point where you can lace up your shoes and go for a walk, that absolutely is going to help you with long-term success. Hope that this helped. Share this with your friends. Bariatric surgery, it's where it's at.